Deputy Howlin, please.
Thank you, Cian Corla. Minister, after 39 years, the Taoiseach made the startling discovery yesterday that Christmas comes every December. There may be scope, indeed, to change rostering at Christmas time, but the Taoiseach should not blame hospital staff, as he did, whatever you say. It was the staff he mentioned for taking their annual entitlement to leave. Rostering and ensuring the presence of sufficient staff, as the Minister has said now, is a management issue and should be addressed through a constructive engagement with trade unions and not with abusing people, either in this House or on the public airways. Another annual phenomenon in the health service is that towards the end of the year, a number of budget lines run out. I'm aware now of several cases where people cannot access a home care package because apparently the budget is run out and they're told to reapply in January. Now that's ludicrous. If the government is serious about using hospital resources effectively, very expensive acute beds, in an efficient way, to take the pressure off the busy Christmas and winter period, surely it makes sense to provide step-down beds and home care packages to patients currently in acute hospital beds who are awaiting transfer home. There are many patients who are most anxious and more appropriately available to be cared for at home. They want to be home. And in a budget just allocated by this House of €17 billion to the Department of Health, we know that the money will be there in January. It's purely an administrative decision not to issue home care packages now. Telling people occupying, in economic terms, very acute beds, but in health terms, very inappropriate beds, to apply again in January is madness. Yet the decision will worsen our bed capacity and the capacity of hospitals to respond to emergencies in this critical period of winter approaching. The government's management of the home care package budget makes no sense to anybody. So I want to ask the Minister two direct questions. Will the government now, today, undertake to unblock the delays in giving home care packages to the list of people that anybody in this House can provide for you, waiting to go home to a more appropriate and less expensive setting? Will the government ensure that patients who need home care packages, such as those who are contacting my office in Wexford, I can give you the details, give you the list, will be home for Christmas?
Thank you, Deputy Howlin. Minister. Well, Deputy, I'm sure the debate on this matter has familiar tones for you as a former Minister for Health and not least indeed as a former Minister for Public Expenditure and Reform as well. And it's not simply a case of throwing money at the issue. We need to make sure that the additional resources that we provide, and we are providing additional resources, are used appropriately. As you'll be aware, in Budget 2019, for example, we did provide, to be expended in the latter end of this year, a fund of 10 million additional euros to be made available to facilitate the appropriate discharge to an appropriate care setting of people who are currently in an acute hospital bed but who are deemed to be no longer in need of that level of care. So we are taking steps, including steps to improve capacity within the health service. But it's not to say that we are not responding accordingly. We are providing additional resources, as you alluded to. The resources provided for in 2019 are significantly increased on 2018. But we did also in the budget make provision for dealing with the issue of appropriate discharge, which in itself frees up acute hospital beds for people who are awaiting admission.
She talks about throwing money at it. Yeah, I am a former Minister for Public Expenditure. I'm talking about value for money as well as massively better health outcomes for people. But isn't it ludicrous? Will you not concede it's ludicrous for somebody to be in an acute bed at enormous cost in our acute hospitals, who is willing, able, anxious to go home, but community care can provide the money for a home care package? So much more money is available within the HSE to keep them in an acute bed then would be required to provide them with the dignity of going home for Christmas. Now, if you can't solve that conundrum, you have no management. There is no system, and it is dysfunctional.
Howlin. Minister. I'm informed by Deputy Daly that we have in fact the HSE commissioned and the Department commissioned a report on that issue of appropriate discharge to appropriate step-down facilities, and that has just been completed. But we did, and you choose to ignore this in your supplementary question, Deputy, we did provide an additional €10 million to be made available.
Why would you spend more on acute beds?
Well, the point I'm making, we are responding with resources to address the issue of people who are inappropriately currently in an acute bed but do not have the facility to be discharged because of a blocked-in system. So that 10 million should go some way towards resolving that issue.